It is usual for the body to produce mucus. Cells in the sinuses, the throat and lungs release water and other molecules that make up mucus. And mucus mainly helps to remove particles, protect the tissues and reduce your risk of infection. Many people produce mucus after waking up or exposure to specific triggers like smoke. But sometimes the body can overproduce mucus, and excess mucus leads to coughing and irritation in the airways. It can also interfere with breathing. Mucus originates in the airways and lungs, but you may be unable to effectively get rid of the mucus through coughing, which allows it to pool in the back of the throat. Learning the cause of excess mucus helps doctors determine the appropriate treatment. And some symptoms of excessive mucus that might make you worry include mucus that's very thick, mucus that's green or yellow or bloody, continually increasing amounts of mucus, and if mucus interferes with your breathing. So it's essential to understand the cause so we choose the proper treatment. What are the reasons you might overproduce mucus? Well, they could be as simple as having a cold or viral sinusitis, or it may be from lung diseases like asthma, COPD, or chronic bronchitis. Conditions like allergies or exposure to irritants can lead to mucus production, as well as exposure to cold air, acid reflux, and some nerve conditions. Some conditions like asthma, COPD, and allergies require specific treatments. There are also drugs like decongestants, expectorants, or mucolytics that can help you get rid of excess mucus. In addition, there are certain self-care measures you can take to reduce excessive mucus production. Number 1, if you have allergies, be aware and avoid exposure to any known triggers. Limiting this reduces the likelihood of particles that can contribute to mucus production. Number 2, stay hydrated with plenty of water and fluids. This helps to keep the mucus from getting too thick and so more difficult to cough up or remove. Number 3, honey or ginger. These may not particularly affect mucus production, but taking them both or separately may help to soothe the throat and reduce cough from excess mucus or phlegm. And lastly is the sinus rinse. Sinus rinses with sterile or boiled water may help to flush out excess mucus. They may also help to remove any allergens that lead to the mucus production. Make sure you choose your rinses carefully and only use those recommended by your family practitioner or ENT specialists. Check out the link in our description for some suggestions. Thank you so much for watching. We'll see you again soon. Bye now.